Hello everyone. As I started the series of lecture for the medicinal chemistry first. In the lecture 4 we already completed the introduction of autonomic nervous system. Now the next point under the autonomic nervous system is sympathomimetic agents. So we will see exactly the sympathomimetic agent means what. So these are the chemical agents which mimic the action of sympathetic nervous system. So these agents are the drugs which mimic the action of sympathetic nervous system, that we call the sympathomimetic agent, and they react with the adrenergic receptors. How they mimic? By reacting with the adrenergic receptors. Now the next thing is that the classification. Based on their mechanism of action, these are classified into the following three classes: direct acting sympathomimetic drugs, indirect acting sympathomimetic drugs, and the mixed acting. See, in case of the direct acting agents, they act directly as agonist on the alpha and beta or the both. Indirect acting agents, they act on the adrenergic neurons to release noradrenaline, and the mixed agents, they act both directly and the indirect way. So the list of drugs are given here under the direct acting, indirect acting, and the mixed acting. So see, first one, the direct acting drugs, it consists of norepinephrine, epinephrine, phenylephrine, dopamine, methyl-dopa, clonidine, nataloxine, oxymetazoline, dobutamine, isoproterenol, terbutaline, salbutamol, and bitolterol. Okay. So apart from these list of drugs, we will complete the main one and as per the exam point of view. Now moving towards the next slide, that is the SAR of sympathomimetic agent, the structural activity relationship of the sympathomimetic agents. So for considering the SAR of sympathomimetic agent, the basic structure of beta-phenyl ethylamine is to be considered. Which drug? That is the beta-phenyl ethylamine. As I shown the structure here, it is a parent compound for studying the SAR of sympathomimetic agent. So there are the four types of the substitutions are possible for this sympathomimetic agent, that is the beta-phenyl ethylamine. So which type of the substitutions are made here? First, the substitutions towards the aromatic ring. So this aromatic ring, the substitutions made toward this one. Second, on the beta carbon, substitution on the alpha carbon, and the last one on the amino group. So on these four places the substitutions are possible, and how the changes are obtained we will see here. So first one, substitution on the aromatic ring of the beta-phenyl ethylamine. So the presence of the OH group, as I shown here, the presence of OH group at the ring with the third and fourth position. It is now in the third and sometime it is in the fourth position. Okay. So what happened? It gives the maximum activity of the alpha and beta. So if OH group is present on the third position or the fourth position, that produces the maximum activity of alpha and beta. Means alpha and beta position that produces the maximum activity. So example is given here. See. Suppose OH group is absent, the overall potency get decreased, and suppose the OH group is absent at the 3 as well as the 4th position, means such compounds are having no any activity. For example, see the phenylephrine. So see, as I shown, phenylephrine, it is a least potent than the adrenaline, because adrenaline is having the 2 OH group and phenylephrine having only 1 OH group. So this is the first regarding the substitution at the aromatic ring of beta-phenyl ethylamine. The next substitution, that is the presence of the OH group. That is the second point. As I told, The OH group is important at the third and the fourth position. In the same way, OH group is important for the third and fifth position. For which purpose? To have the maximum activity for the beta 2 selective drug. Next, the drugs having the substitution other than the OH group. Okay. Apart from the OH group, if the drug having some other group attached to it, what happen? It leads to its increasing or the greater activity of the adrenergic receptor. And the fourth point is that the unsubstituted or the alkyl substituted adrenergic amines, they easily cross the blood-brain barrier and have more CNS activity. The structure of the beta-phenyl methylamine having the alkyl substitution as well as the unsubstituted amine group are present, then that will cross the blood-brain barrier and having more potent CNS activity. That is, example is amphetamine. Now the second substitution on the beta carbon. So if the OH group is present on the beta position, that decreases the CNS activity, that is a central stimulant action. Third is substitution on the alpha carbon. If the substitutions on the alpha carbon present, that blocks the metabolism caused by the methyl amino oxidase, and that's why they should have the longer duration of action. Then the last substitution, that is substitution on the amino group. So regarding the amino group, which type of the substitution is important? See, lesser the substitution on the amino group, that leads to the higher selectivity of the alpha receptors. More size of the alkyl substitution, higher will be the beta selective action. The phenyl ring must be separated from the side chain of the amino by the 2 carbon atom. So see this structure. In this structure, this phenyl group, it should be separated from this amino group by the 2 carbon atoms. And these 2 carbons are not more than the 2 or not less than the 2 in order to obtain the sympathomimetic activity. So this is the SAR of sympathomimetic agent with its 4 substitutions. Substitution on the aromatic ring, substitution on the beta group, alpha carbon, and lastly the amino group. Now moving towards the next slide, as we seen, the sympathomimetic agents classified into the 3 basic classes on the basis of their mechanism of action: direct acting drugs, indirect acting drugs, and the mixed acting drugs. One by one we will see the important drugs from each category. The first one is the direct acting drugs. So see, the direct acting drugs, they produces the sympathetic response by interacting directly with the adrenergic receptors. On the basis of the name, they directly interact or bind with the adrenergic receptors and show its response. The first drug from this category is norepinephrine or noradrenaline. As I told, it is a hormone. So see its structure. Moving towards its mechanism of action, it is a potent agonist at alpha receptor and has little or no effect on the beta receptor. So see, it is a potent one having its action, agonist action at alpha receptor but no effect on the beta receptor. Again, it has effect on the beta 1 receptor also. Okay, as it having the no effect on the beta 2 but having a little effect on a beta 1 receptor. It is a potent than adrenaline. As compared to the adrenaline hormone, it is a more potent. Now moving towards the next point, its uses. It is used to reduce the absorption and localize the effect of local anesthetics. It decreases the chances of hemorrhage during an operation. It is given by the intravenous route for the treatment of hypotension. And last one, it having the strong vasoconstrictive vasoconstricting property, means vasoconstriction agent. That is the fourth use. Now moving toward the second drug, that is the epinephrine, or we may call it adrenaline. See the structure of epinephrine. First, its mechanism of action. Again, it is also the direct acting sympathomimetic agent. It directly interacts with the alpha 1 and beta 2 receptors, and it is a highly potent among all the direct acting drugs. As I told, it is a more potent as compared to the all the drugs which comes under the direct acting category. Second thing is that it is inactive when it is given by the mouth. Okay, it is inactive when it is taken by the mouth because it undergo the enzymatic degradation and passes the first pass metabolism in the liver. So always it is prepared with the pivallic acid in order to avoid its enzymatic degradation. After that, the next point is uses. As I told, it is inactive when it given by the mouth, so we should prefer a subcutaneous route to produce the vasoconstriction effect. It is used in the treatment of anaphylaxis and anaphylactic shock. Again, it relaxes the bronchial muscles and the treatment of asthma. Next one is what? The aqueous solution of epinephrine were used as inhalation in the form of the spray to reduce the asthmatic spasm. Okay, and after that the last one, it used in the form of spray in the allergic rhinitis, hay fever and sinusitis. Okay, now the third drug from the direct acting category of sympathomimetic agent is phenylephrine. Okay, phenylephrine. So see, first important point is regarding the synthesis. It is prepared by the reaction of m-chloroacetylphenol, that is the meta position, and methylamine, So here on the arrow, methylamine followed by the reduction of the intermediate. So this intermediate product is followed by the reduction process and we will obtain the phenylephrine. Okay, so this intermediate product and finally we will obtain the phenylephrine. So this is the synthesis of the phenylephrine. Now moving towards its mechanism of action. See, it is a selective alpha 1 agonist and has no action of the beta receptors. Okay, as it is helpful for acting on the alpha 1 receptor, but it will not have any type of effect on the beta receptors. Second thing, activation of this receptor causes vasoconstriction of the arterioles, iris and contraction of the uterus. Third point, uses. It is mainly used as a decongestant in the rhinitis and sinusitis. It is used in the eye for producing mydriasis. And third one, it is used as a pressure agent in the hypertensive state. So these are the uses of the phenylephrine. Now moving toward the fourth drug, that is a dopamine. First thing, its mechanism of action. It interacts directly on the beta adrenergic receptors. It directly bind with the beta adrenergic receptors and indirectly to the alpha adrenergic receptors. Directly to the beta, indirectly to the alpha, and it will show its action. Uses: used in the treatment of patient shock, used in the treatment of congestive heart failure, and third, used in the myocardial infarction and cardiac surgery in terms of intravenous form. Fifth drug from this category is salbutamol, and which is the important one. by considering its synthesis. Mechanism of action: it is a strong beta-2 adrenergic agonist. It is a directly acting sympathomimetic drug having strong action on beta-2 receptors. Having the strong action of beta-2 receptors, that is its mechanism of action. Agonist means the agent which supports the action, and antagonist means the agent which depresses the action of the drug or which avoid the action of the drug. Synthesis: see here, the orthohydroxybenzyl alcohol treating with the chloroacetyl chloride produces an intermediate product which were further treated with the MPV reduction. It will undergo the MPV reduction and finally produces the salbutamol. Finally it will produces the salbutamol, that is the synthesis of salbutamol. And next thing is that uses. Orally as an inhalation, it is used for the sympathomimetic relief of the bronchospasm associated with the acute as well as the chronic asthma. So it is used for the both purposes, acute or chronic asthma. Second thing, it is used in the treatment of bronchitis and other obstructive pulmonary diseases. Obstructive pulmonary diseases. So with this we completed in detail the sympathomimetic agents with its classes. From these three classes we completed the first direct acting drug with the detailed information and the important drug from this category. And as I told, these PPT are the complete notes for the medicinal chemistry first as per the PCI syllabus. So students, refer it, and thank you everyone.